Thank you for staying with us on Channels Television. A warm welcome to Health Matters. I am Yomi Otaigbe. Our conversation today on the show will center around kidney care and what you can do to prevent chronic kidney disease. The kidneys, which are a pair of bean-shaped organs, perform essential functions in the body to maintain overall health. We'll shed light on those factors that put the kidneys at risk and how to keep them healthy. To keep it locked on Channels Television. Joining me now on the show is a consultant nephrologist who is also the head of dialysis unit at the Federal Medical Center, Ebute Metta, Lagos, Dr. Danladi Madu. Thank you so much for joining us.
Thank you, Yomi, for having me.
I was trying to marry that name, Danladi Madu.
I'm a true Nigerian.
Okay, that's good. We are all Nigerians. Indeed, each of the kidneys, you know, they're about the size of a fist, and they do a lot. Let's start by you telling us more about what the kidneys do in the human body.
Thank you once again for having me, Yomi. It's a good time to share light on the kidneys. So there are these two bean-shaped organs, and they're at the back. And it's through avenues like this we're able to bring them forward so people can see what they do. What the kidneys do is that they take out waste from the body. That's the primary job of the kidney. So when you go about your daily business, you eat, the waste that is generated is taken in the blood to the kidneys. And then the kidney washes out the waste. So the kidney is constantly cleaning your blood. And that's the main job of the kidney. But the kidney is like a Nigerian. The kidney has a side hustle. It has something else it does on the side. So the kidney also helps the body to make blood. So people who have kidney disease, their blood levels tend to go down. And then the kidney helps with bones. And finally, the kidney also helps to control blood pressure. So the kidney really does a lot of things.
So it helps to filter waste in the body. It helps to
make blood, yes. The blood levels, your PCV is tied to what your kidney can do. So if your kidney is not working well, the person's PCV starts to go down. Then the kidney also helps with formation of bones, calcium. And then the kidney also helps with controlling blood pressure. So most of my patients have very elevated blood pressures once the kidney is not able to regulate blood pressure.
And we don't want you to have so many patients, and that's why we are having this discussion. So let's talk about those factors that can hurt the kidneys, you know, some of those habits that actually puts a lot of a lot of stress on the kidneys.
So the big thing that we tend to advocate for, one of the big things is hydration, drinking a lot of water. There is, we have a lot of data now in Nigeria that shows that kidney failure occurs more in the dry season. And we all know the sun is out there now. So you want to drink a lot of water, you want to stay hydrated. That really, really does help the kidneys. The other thing is with a lot of the medications, over-the-counter drugs, some of them tend to really have a strong impact on the kidney, especially the non-steroidal anti-inflammatory drugs can impact the kidney, so you don't want to take medication indiscriminately. A few other things, alcohol, smoking is very big, sedentary lifestyle, not doing too much exercise. Finally, I'll end by saying that the most common cause of kidney failure in Nigeria is still hypertension, followed by diabetes. So the one way to prevent kidney disease is, one, control your blood pressure, control your blood sugar, but also check. You want to check your kidneys regularly because you can, I'm sure we've all heard of kidney transplants. Without one kidney, someone can survive normally. So one kidney, with one kidney alone, you can survive. So that shows that by the time someone presents with kidney failure, the two kidneys have shut down completely. And the only way you can know when you start to have small disease in the kidney is to check. So you need to have routine checks, even when you are feeling well, to know the status of your kidney.
So we'll still come to some of those things we need to do, some of which I think you're alluding to already, to ensure that our kidneys stay optimal in function. But let me stay with some of the causes or some of those risks and things that put stress on the kidneys. You have said hypertension, you've said diabetes. I heard about the use of some kind of drugs, even as simple as what we call paracetamol, how the abuse can also affect the kidneys. Let's talk about that.
Okay, so some of the pain medication we use commonly, especially those ones we call NSAIDs, when they are used indiscriminately for long periods of time, they can damage the kidneys. So those ones, they affect the blood flow. They also affect the function of the kidney intrinsically. So it's not good to use them for protracted periods indiscriminately. And they're not bad medications, but you just don't want to use them for long periods and use them indiscriminately, because most of them are over the counter. You can just walk into a pharmacy and buy them. So you want to be careful with those ones.
And because, oh, I have a slight headache, and some people just, reach out. You want to know exactly what is causing that headache. And as, okay, how will I describe it? Paracetamol would say, okay, it's one of those over-the-counter medication that you can pick without prescription, but they also have the powers when they are abused to affect the kidneys. Now, let's talk more about high blood pressure, which that I think 4 in 10 Nigerians, if I'm correct with that data, would have high blood pressure. So let's talk about that part of it. What do we need to do to ensure that our blood pressure, they are, where they should be?
So they say hypertension is a disease of the black man. So it affects men, and it tends to affect black individuals more than those in the other populations. We generally want to live a healthy lifestyle. Reduce the amount of salt in your food. And then all those seasonings, I don't want to call names, but all those seasonings, you want to taper down on those things. Also exercise and increasing vegetable intake. All those things have an impact on your blood pressure. But most importantly, it brings us back to checking. You just want to assess your blood pressure, especially if you've had a family history of blood pressure, or you've checked your blood pressure to be high. You want to, I personally tell all my patients, you must have a SWIG at home. Not just to check yourself, but also people that come to visit you, you should check their blood pressures as well. So it's important to check, but also live a healthy lifestyle. That's the only way around hypertension.
And really. Diabetes too?
Diabetes, the same things. In fact, brother and sister. So diabetes is one of those things. It can even cause you to have hypertension from the impact it can have on the kidney and on the blood vessels as well. So you want to just regularly check this and live a healthy lifestyle in terms of diet, in terms of exercising, in terms of, moving around and doing a lot more. But importantly, checking.
So let's talk about those symptoms now.
Yes.
The symptoms that I know sometimes when the symptoms will come, the disease may have, advanced, to a certain level. So let's talk about the symptoms that could, point to a chronic kidney disease.
So like we said earlier, the kidneys are very resilient organs. They're like Nigerians. They can survive anything. So the kidneys, generally, in the early stages, we don't see anything. The person is normal. But when it starts to get towards the end, there are 5 stages of kidney disease. In stage 1, stage 2, you really don't see much. It's the later parts of stage 3 we start to see issues. And then stage 4, it's getting really bad, and then you have a lot of symptoms. And then stage 5 is when we see the person starts to need dialysis or a kidney transplant. Usually, I said is the kidney takes out waste. So when the kidney can't take out that waste, what happens is the waste accumulates in the body. It could accumulate in the brain, making the person drowsy, sleepy, sometimes even have convulsions. Sometimes it could accumulate in the heart, causing chest pain. In the stomach, it could make the person have ulcer-like disease. Sometimes they may even vomit blood. It can also, the kidney works by removing this waste as urine. So when people are not able to urinate well, fluid accumulates in their legs. They can have leg swelling. Sometimes they can have swelling around their face. And I already said the kidney controls blood pressure. So blood pressure can start to go up, can be a symptom of kidney disease. So kidney disease can cause blood pressure, hypertension, and hypertension can also cause kidney disease. And then, like I said, with blood, the kidney helps the body to make blood. In the later stages, the person's blood level also starts to come down. So those are some of the things we can see in patients with kidney disease.
All right. The 2026 theme for the World Kidney Day is chronic kidney disease in disadvantaged populations. Yes. From your practice, you see patients, what do you see in terms of the information they may have had or they didn't have that could have brought them to that point? And how can we make the management of kidney disease better in Nigeria?
I think the biggest thing about kidney disease is just the fact that it's at the back. The location of the kidney is a problem. No one thinks about it and no one checks it. And it's not obvious. So the most common problem I see is that people don't check their kidneys. So I think it's important that if you, in knowing your numbers, you should know your blood pressure, know your blood sugar, but also know the status of your kidney. It's a simple test. It's a blood test. If you go to the hospital, they just take a blood test from you. And you know I said the kidney removes waste. All we do is we check the waste level. If it's high, it tells us your kidneys are not working well. If it's very low, it means your kidneys are overworking. That's also a problem. So it should be a certain level. It's just a blood test. But we also take a urine test as well, and we also do a scan of the kidney. So it's very simple, a couple of minutes you're out. So I think the biggest issue is that people do not know. They present late. When patients present late, there isn't so much you can do for them. The kidneys are failed, and then they start dialysis. Dialysis is very expensive. It will cost roughly 50,000 per session of dialysis. 3 sessions of dialysis in a week is 150,000. That's about 600,000 every month. Even I can't afford that. So it's not affordable, and most people can't. The government is doing a little now. The government is doing well. There are centers across the country that have subsidized dialysis. FMC Butemeta has dialysis at 12,000. So government subsidizes it to 12,000. Well, the government can still do more. Government also provides drugs now for some of those patients, and we also would like the government to also try and push this towards free, so Nigerians can, survive with severe renal impairment. And secondly, the definitive treatment for patients with kidney failure is a transplant. We don't have a transplant program yet, but it's going through the legislation. We're towards the end of that, trying to get the laws in place around the transplant program. So that will also help patients, get their lives back on track. Because dialysis is not only expensive, but patients spend a lot of time in hospital receiving dialysis, which is not good for quality of life.
And the psychological impact too, aside from the funds that needs to be spent. So we stay with the issue of prevention, which is very key. I want us to stay more on that. You have mentioned the screening. For that screening, how long does it take, and what is the average cost, so that Nigerians can know that this is doable?
It's actually not very expensive, but it would vary from which centers you go to. But there are places like, for advocacy, the World Kidney Day, which was Thursday this week, a lot of places are doing it for free. You could just walk in, and I believe the Nigerian Association of Nephrology Nurses are doing a screening in St. Luke's tomorrow. So if you want to get a free screening for your kidneys, you can go there. It's in St. Luke's in Isheri, so you can go there and get free screening. But for the cost, I think within the range of 30,000, you should be able to get some decent screening done. But for your urine and blood, the blood one is actually as low as 3,000, which is usually the most important thing I want to check. So the blood test can be as low as 3,000 in some places, and there are routine screenings going on. So you can just lash on to, if you follow the nephrology associations, we tend to have free screenings every now and then. So you could just lash into one of them and
get
screened for at no cost. Okay. We do some screening sometimes at the Federal Medical Center at Butemeta. So if you do want to get screening, sometimes you can come in there, especially if you have symptoms. One of the symptoms...
Do you have the days for the screening?
So we are looking towards having a screening every Wednesday now, in which you can just come. At least we can do the urine tests for you at no cost to you. The blood tests, we're working on a subsidized amount for that. But for the urine test, we're going to do it at no cost. You come, we just take your urine, and then we see whether you have kidney disease or not, and then we can go on to the next steps.
Okay, we'll just take a very quick break, and when we come back, we'll still have Dr. Mado in the house, and you can also ask your question or join us in this conversation. Just stay with us.
At least 4 in 10, that is 40% of Nigerian adults, live with hypertension. And
Dr. Danladi Madu.
Yes.
Let's talk more about the prevention. You have said we should exercise, we should avoid salt intake, high salt intake, smoking. Let's talk more about that because it's very important. All of this cost that you have put on, it's not something someone wants to toy with. So let's talk about prevention. And just to remind our viewers that the number showing on your screen, you can call in to ask your question or your comment.
Okay, so it's important, first of all, prevention starts with even knowing. You know, they say with knowledge, half your problems are solved. So you want to screen and check. Like I said, if you know your number, you should know your serum creatinine, you should know your kidney function levels. And after that, just healthy lifestyle. I try to say the currency of the kidney is water. That's what you know, they say economies are in recession, Naira is under pressure. The Naira of the kidney is water. So you want to drink a lot of water. Drinking at least 3 liters of water. I tell my patients, take it a little more because of the sun. The weather is really hot now. So drink at least 3 to 4 liters of water every day, just to keep your kidneys functioning.
But before you go on with the water, some people would also say, watch how much water you also take, depending on your health status.
Yes. So if you are followed up by, let's say, a cardiologist and you have a severe heart problem, or if your kidneys are in the latter stages of disease, yes, you can restrict water. But there are limited, very small population of people who water should be restricted for. And trust me, if you have an illness where you need to restrict water, you will definitely know by now. So, but other than that, drinking a lot of water helps. It's hard to, if you are healthy, it's hard to overhydrate yourself because that means you have to take, data shows that you have to take up to 20 liters of water before you say you're taking too much water. So drink water, you can't go wrong with that. The other thing is your diet. Increase vegetable intake. For a healthy kidney, you need up to half of your food to be vegetables. So you need to eat a lot of vegetables. Then I talked about salt. You want to reduce your salt intake and then know your numbers. Know your blood pressure, know your blood sugar.
No abuse of
non-anti-inflammatory drugs. Smoking, alcohol intake excessively is also an issue. And generally just look after yourself. Bleaching creams and all that. We know that just, most people know these things, but it's just important to...
Bleaching creams also
yes,
because of the content of the cream.
Bleaching, yes, you know, these things can penetrate, eventually penetrate the skin. And then generally herbal concoctions, they're not all of them are bad, but the problem is we don't even know what's in them. I don't know, there's no standards regulating them, so you want to be careful with what you put into your body because I tell my patients, anything you put in your body will eventually end up in your kidney at some point. So if you put something bad in your kidney,
in your body, then
your kidney will ask you for it at some point. So
thank you so much. Thank you for your insights today on Health Matters. I've been having a chat with a consultant nephrologist who is also the head of dialysis unit at the Federal Medical Center, Ebute Meta, Lagos, Dr. Danladi Madu. Thank you indeed for your time.
Thank you for having me.
And we'll still have some time to show you what's happening in the health world.
At least 4 in 10, that is 40% of Nigerian adults, live with hypertension, and this is according to the 2025 State of Health of the Nation report released by the Federal Ministry of Health and Social Welfare. The report, produced in line with the National Health Act 2014, highlights a persistent public health challenge posed by high blood pressure, while noting some progress in awareness, screening, and prevention efforts. The report shows that while the prevalence of hypertension remains high, awareness of high blood pressure and other cardiovascular diseases improved in 2025 compared with 2024. The report attributed the improvement partly to intensified public health campaigns led by the Federal Ministry of Health and Social Welfare and professional health bodies. These campaigns focus on educating Nigerians about the risks associated with high blood pressure and encouraging routine health checks. Hypertension, commonly called high blood pressure, is one of the world's leading causes of heart disease, stroke, and kidney failure. It is described as a silent killer because it often presents no symptoms until serious complications set in. As part of efforts to curb the spread of poliomyelitis, the Zamfara state government has commenced a statewide campaign for oral polio vaccination following the confirmation of 4 new polio cases in parts of the state. The incident manager at the Zamfara State Polio Emergency Operations Center, Murtala Salau, disclosed this while addressing journalists in Gusau, the Zamfara state capital. Mr. Salau explained that the vaccination exercise became necessary after new cases of polio in 2 local government areas, prompting an urgent response by health authorities. He adds that more than 1.3 million children under the age of 5 are being targeted in the house-to-house immunization campaign across the state.
In the early months of this year, in January, we have recorded so far 4 cases of poliovirus, 3 coming from Gumi LGA and 1 from Safi LGA. So, by strategically and based on this rationale, in Zamfara State, in collaboration with the National Primary Healthcare Development Agency, have decided that it is time for us to do an overall state campaign to ensure that we reach almost all the children that are eligible under the ages of 5, so we can vaccinate them with the polio virus. This time around, we're doing a co-administration of NOPV and BOPV.
And more than 2 weeks into the latest escalation of conflict in the Middle East, health systems across the region are coming under strain as injuries and displacements rise, attacks on healthcare facilities continue, and public health risks increase. According to the World Health Organization, national health authorities in Iran, Lebanon, and Israel have reported several deaths and thousands of injuries in the 3 countries. At the same time, the conflict is affecting the very services meant to save lives. In Iran, who has verified 18 attacks on healthcare since February 28th, resulting in 8 deaths among health workers. Over the same period in Lebanon, 25 attacks on healthcare facilities have resulted in 16 deaths and 29 injuries. The WHO calls on all parties to protect civilians and healthcare facilities, ensuring unimpeded and sustained humanitarian access, and pursue de-escalation of the conflict so communities can begin to recover and move towards peace.
And that's Health Matters for this week. Thank you so much for being a part of the show. I'll see you again next week. I am Yomi Otaigbe.